Hi there, this is Dr. John Whitcomb talking about how to repair post-COVID myocarditis in children. This is a hot topic, at least in the time of the early pandemic when some children given the vaccine developed chest pain and myocarditis. It caused a fair amount of vaccine hesitancy for modest reason. We now know later, now that we've had some experience, that actually the disease causes about 10 times the amount of myocarditis as the vaccine. And the general principle is you can't use a protein from a dangerous virus without getting some of the dangerous side effects. So 10 to 1 ratio suggests you're probably better off with the vaccine. Okay, but imagine a young child who got COVID myocarditis in Seattle. And this is reported in a phone conference, not in my personal experience, who was sent to the ER to get a chest CT, and the chest CT was normal. And his C-reactive protein, which should have been below 1, was 120, stunningly high. The pediatrician was just learning to use the plasmalogen supplement called brough, and she gave him 100 milligrams per kilo. And the child had been sent home from the ER with instructions that he was going to be sick for a month, that he had post-COVID myocarditis, he'd get better, he was to play quietly, had a school note for a month, and not to exercise, and no pillow fights, no bike rides, etc. Next morning, after 1 dose of brough, was asymptomatic. The pediatrician was called and was stunned to see such a rapid response, requested they go back to the hospital to get another C-reactive protein. Instead of 120, it was 30. They repeated the dose of 100 milligrams per kilo and repeated the C-reactive protein the next day, and it was under 1. The pediatrician did the right thing. She reported this to her pediatric group, which proceeded to send her 6 more cases, so she did the exact workup on all 7 cases and had the exact same finding. Those kids got better in 1 day. Okay? I had a very similar case. Severe migraine headache, worst headache in life, terrible agonizing pain, did not respond to IV Decadron, did not respond to IV Reglan, did not respond to all the medications an ER gives for migraine headaches, still had a pain of 10 out of 10, and 100 milligrams per kilo of brough repaired the headache in 4 hours. After the ER told them the person they'd be sick for 2 to 3 months would probably not be able to work for a month. What's happening that makes it work so quickly? COVID is a massive infusion of oxidative stress. Mitochondria get damaged all over the place, electrons escape, and that makes a tsunami of peroxide overcoming the natural glutathione in blood levels. And sure enough, if you measure post-COVID patients, they all have very low glutathione, published literature. And that allows the peroxide to penetrate as far as the membranes of cells. Now, in the heart, the sarcolemma is very high percentage plasmalogen. So if you have a flood of plasmalogens are the protector, the antioxidant of first resort. They have a vinyl ether bond on their surface that protects the cells for the occasional errant peroxide. But when a tsunami shows up, you strip away much of the membrane, exposing naked muscle fibers. And C-reactive protein does what it's meant to do. The immune system is seeing damaged heart cells. It comes to the rescue. That's what happens in all autoimmune diseases. Some oxidative stress comes along, damages the native tissue. Your immune system then starts trying to clean the tissue up. That's the cause of autoimmune diseases. Well, we're now repairing post-COVID. I personally, as an integrative physician, have treated about 20 post-COVID patients now, and most of them are completely better within a week. when you treat them with plasmalogen therapy. This is terribly exciting. We're going to change the world with these plasmalogens. Keep paying attention, keep reading, keep listening. We're building this car as we're putting the wheels on. Very exciting ideas. We need to prove it. We need clinical research, but it's coming, and there's no toxicity to the plasmalogen supplements. Very exciting. Dr. John Whitcomb for News and Nutrition. You can repair post-COVID headaches. You can repair post-COVID myocarditis.